A privilege for me to introduce these speakers and to talk about this first webinar in this series. This features a unique electronic tool for communities to start or enhance oral health programs for older adults. Today, Ms. Mary Worstel and Mr. Fontaine Sproles will provide an overview of these resources to assist in start or enhancing an oral health program for older adults in your community. Let me introduce our speakers for today. Ms. Mary Worstel is a senior advisor to the Deputy Assistant Secretary of Health Sciences and Medicine. She has worked on federal initiatives on healthy aging, including previous work for the White House and for the Centers for Medicare and Medicaid Services. Previous to her federal service, Ms. Worstel was the Executive Director for the Asthma and Allergy Foundation of America. Also leading the webinar today is Mr. Fontaine Sproles. Mr. Sproles currently works in the Office of Nutrition and Health Promotion Programs within the Administration on Aging, where he manages the program featured today in this webinar. Prior to joining the Administration of Community Living, Mr. Sproles was a community planner at the U.S. Department of Transportation, where he managed multi-million-dollar technical assistance program. We want to thank our speakers, both Ms. Worstel and Mr. Sproles, for joining us today and to introduce this tool. Thank you both.
Thank you, David. This is Mary Worstel, and we'll begin our slide presentation in a moment. As we get into that, I wanted to say it's a pleasure to be with you this afternoon, and I'm just going to tell you a little bit of a story to give you a context of how my involvement in oral health came about. I was working with the Centers for Medicare and Medicaid Services, and it became clear to me in work that I was doing with HHS in general and with the Office of Women's Health in particular that much of women's health focuses on women during the childbearing years. And as we age, there is some information that's provided on menopause, but then focus on women's health pretty much falls off the cliff. And knowing what I knew within my work in Medicare, knowing that there are 10,000 individuals who age into Medicare every day for the next 10 years, and that we were experiencing a demographic shift in the United States, I began to focus on women and aging in the United States in an effort to kind of balance the equation and draw interest about women's health further down the continuum. And so I'm going to present a few of the statistics on women and aging in the United States so that you can see, in fact, that aging is not a one-size-fits-all, but in fact, it, sorry, my cell phone's ringing. So in fact, women have a disproportionate, or we are a disproportionate body of the aging population. So if you look, I'll call your attention to two of the bullets here. In 2015, the sex ratio of women, and this is age 65 plus, was 126.5 women to men, and the sex ratio at 85 years and older was 189.2 women per 100 men. If you go down to the fourth bullet, you'll look at the in 2015, the median money income for 65 and older was $31,373 for men and $18,250 for women. And if you look at the last bullet, older adults averaged out-of-pocket health expenditures of almost $6,000 a year, which was a 37% increase over 2005. And that out-of-pocket health expenditures does not include oral health, vision, or hearing, all our conditions which disproportionately impact individuals as we age. And so as knowing this, and so knowing that women live longer than men and that women age with an economic disadvantage as compared to men, I was really looking to say, how could I begin work in the Office of Women's Health that would focus and make a difference for this older adult female population. And I had the great fortune to work with Dr. Marian Mahegan, a dentist by training, who was the regional coordinator for women's health out of Region 1. And she introduced me to oral health. And so, and here's what I learned from her. And Fontaine, we can move to the next slide. If we look at, Marian introduced me to the fact about literally the mouth being the entry to the body. It's a critical component of health. There's a connection between a healthy mouth and a healthy body, and that bleeding gums, visible root surfaces, and loose teeth are not normal at any age. And I'm also caregiver for my 94-year-old mother, who is almost blind and almost deaf, but otherwise in very good health. And I visit her. She lives in a continuous care community. She lives independently, and so I share dinner with her frequently. And what I have seen there with individuals with poor oral health is truly amazing. When you say poor oral health can cause pain and difficulty in speaking, I see that in a number of the residents there. They have difficult chewing, which limits what they can eat. They have difficult swallowing, and they have difficult sleeping from the pain. I also see that oral health can be associated with loss of self-esteem. And I notice people, when they eat, they cover their mouth because they're embarrassed. They don't want people to see their teeth. When they laugh or smile, they also cover their mouth. They're embarrassed by their teeth. So it affects the way they feel about themselves and the way they interact with others. And of course, this can lead to them isolating themselves, and that can lead to depression. So you see the day-to-day quality of life that this has, in addition to the physical pain and the relationship to other diseases, which we note in the last bullet on this slide. Much of this I know you are aware of. So we can go to the next slide. I also then began to learn about the barriers to oral health. And as I said, you know, oral health, vision, and hearing are the three areas for which there is no subsidy out of Medicare for older adults. As I explored this even further, I learned more about, and I know you know very well, the limitations of Medicaid to cover adult oral health services for anyone over the age, I believe it's of 21 or 25. And so if we look at this, and you know this, and you may know where Texas falls upon this, what I think is very important to keep in mind is that there are 22 states that offer virtually no oral health or only emergency oral health under Medicaid for adults of any age. And of course, Medicare offers no subsidy for oral health for any of its beneficiaries. So we can move to the next slide. And so with that information, we said, what could we do? And in 2012, the HHS was developing the HHS Oral Health Strategy, and they brought in a number of stakeholders to talk and advise HHS on what focus there needed to be. And I was able to encourage them to include 3 slots at a round table of about 20 people to focus on oral health in older adults. And what I learned from that, and then another chance encounter at an oral health meeting where I was able to talk with people about what do we do for oral and what do they know, what have they seen at community level, I learned that there were a number of activities happening at the local level throughout the country, some that had originally started with grant funding, which had ended, others that communities had said, we just need to do something for adults in our community, let's figure out what we can do. And these programs were ongoing. And so I came back and I said, if there is some way that we could, in fact, enhance the visibility of what is happening today at the local level so that other communities who want to do something wouldn't have to just sit and stare at a blank wall, but say, we could learn from these other experiences. If we could make those experiences more visible, other communities could all be served and wouldn't have to start at zero. And so we decided we would develop a project funded by the Office of Women's Health, and with the Administration on Community Living, and the purpose of the project would be to identify and promote vetted, low-cost, community-based oral health programs for older adults. And we said along with that, we would develop a guide for communities that wanted to do this, wanted to either start a program in their area or enhance a program they already had existing. We would present them with a guide on how to do that at the community level. It would be a how-to guide for the communities. So next slide, Fontaine. And I know you know this, I just want to highlight it a little bit more. If we look at the prevalence of dental caries among older adults, and at the top, the first set of statistics are treated and untreated, and then below that you see the untreated dental caries. The real important parts about this are that nearly all adults, 96.2%, have had some experience with treated or untreated dental caries. And the second figure tells us that 18.9% of adults in the United States ages 65 and over in 2011 or 2012 had untreated dental caries. And then let's not forget that, you know, along with this, and certainly in the older adult population, it's estimated about 66% of older adults suffer gum disease, and that's according to the CDC. The next slide is the prevalence of tooth loss among older adults. And excuse me, as we have said, we know that tooth loss negatively affects the oral health and oral health related quality of life. And if we just look at this figure, 18.6% of adults in the United States ages 65 and older experienced complete tooth loss in 2011-2012. And this condition was twice as prevalent for the 75 and over age group as compared with the 65 to 74-year-old age group. And so that infers that complete tooth loss becomes more common with age. And then, as I had mentioned earlier, if we look at these statistics, 42% of low-income adults have difficulty biting and chewing. This has a lot to do then with what they can eat and how much they can eat, and that contributes directly to nutritional status in many of these individuals. 23% of low-income adults reduce participation in social activities due to the condition of their mouth and teeth, and I was describing to you what I have seen firsthand where my mother lives and how people isolate themselves and really cannot participate fully when they're in community. And you have other statistics here that will echo what I presented earlier. So the last slide is we really felt that we could put together something at the federal level, but to do so, we needed to form a community of individuals that would bring us a full range of expertise and guidance to this effort. And so we formed what we call a subject matter expert working group. This group, you can see here the different groups that were involved in it. We had representatives from all of these different groups. So they represented federal and non-federal, dental groups, aging groups. We had virtual experts in virtual oral health. We had experts in community-based oral health, both in community at large as well as in assisted living and nursing home, and we brought in as well people from the Health Resources and Services Administration that oversee oral health care that's delivered through the federal qualified health centers and community health centers. And this group formed what we call our subject matter expert group. They advised us, and Fontaine will give you more information about that, but they informed us on all aspects of this program, from how we approach the development of this down to, as you will see, the design of the website, the functionality of the website, and certainly the content to our guide. So the next slide is these individuals worked with the Administration on Community Living, with the Office of Women's Health, and our contractor, the Lewin Group, to produce two key project components. The first is an oral health programs database, which is a searchable database of community-based oral health programs that we know of today in the United States. And this database, we hope, will only grow as more of you become aware of it and submit evidence of additional programs to us that we could add to it. And then the second component is the community guide to adult oral health program implementation. And I will just say for that this, when we knew we wanted to do a guide, we knew that there were a lot of guides already out there. Our subject matter experts helped us to identify aspects of existing guides that were very relevant to what we needed to include for this purpose, and then helped us to identify and actually script the additional content to make it a complete guide and lead us to referral resources that you can access in the guide that they would certify are quality information. And so both of these tools are available on the oralhealth.acl.gov website. And I will turn the presentation now over to Fontaine.
Thank you very, very much, Mary, and hello to all of you. I'm excited to be before you and provide you with what I consider to be the what. Mary has provided you with context on the why and the project that we commissioned as a result of the why. But the what is the output, and that is the database and the community guide that Mary mentioned just a few moments ago. So as part of the database, we were able to identify approximately 200 programs throughout the country that are oral health related programs serving older adults. And as part of this process, the Lewin Group convened, of course, as Mary mentioned, the subject matter experts to review and collect and review programs throughout the country. And as part of that process, they evaluated and used a very specific criteria to determine what programs would be included in the database. So here's what you see as a result of that process. And again, the database includes approximately 200 programs that serve older adults and meet the needs at this level and fulfilling the gap that Mary mentioned a little bit earlier. So as part of the database, and I'll demo the database later on in our discussion, a person is able to go to the tab in the database entitled, or a tab in the website entitled the Oral Health Programs Database, and select a number of criteria based upon the specific things or services that you all are looking for. So you're able to type in a keyword related to the database, related to the search criteria, or specific populations, delivery of setting, program funding, other program services such as patient education or caregiver education. So this is a searchable database of approximately 200 programs. Once you have searched for the specific criteria that one is looking for, a program profile is able to populate. And these program profiles include not only an overview and a website link to the particular program, but it also includes the target population, the model type, and the services delivered. Now, of those 207 programs, we do have what are considered featured program profiles. And those programs scored based upon the criteria a little bit higher than some of the others and include more detailed information in their program profiles, such as the program history and development, the program sustainability, and the program impact. You'll see what those featured programs are and their indicator by way of a star when I pull up the website. But feel free, as I am discussing the various components, to access the website as well so that you're ready to walk through the website at the same time as me. So I mentioned 200 or so programs in our database. And as part of the environmental scan for these programs, we found that they fell into about 6 common service delivery models. And those common delivery models included a dental clinic model, which is one that's freestanding, whether that be in community health centers, federally qualified health centers, or other permanent settings. So in the database, you have a number of programs that fall into that particular type of delivery model. The other delivery model we found across the 200 or so programs was the mobile portable model. And that is services delivered in a mobile dental vehicle or at a fixed location with portable dental equipment. I'm sure you all may be familiar with those, and there are many examples of those types of programs in the database. The third model that we found as part of the environmental scan and included in the 200 programs is the eligibility and enrollment model, which is essentially care coordination, and that is managing and arranging appointments and transportation as well as payment counselors and enrollment. We find that the network, and that is the bedrock of the area agency, of the Administration for Community Living, the agency that I represent, the bedrock of our network are area agencies on aging, and they're called AAAs for short. They usually fall into either this model or the event-based model, and we find this type of model across a number of the 206 programs. Another example is the virtual model, and that is providers being able to serve and exchange information via technology by way of Skype or some other means of remote assistance. The fifth model that we found to be prevalent is the event-based model, and that is those that are taking place on a large scale, a one-day or a weekend event such as a Mission of Mercy or another example that I'll mention later on. And the final model that we found across the 200 or so programs is the outreach and education model. And that is being able to provide clients, caregivers, and providers education and raising awareness related to oral health. So while there may be a number of different other types of models, we did find these 6 to be most prevalent amongst the 200 or so programs. So just digging a little bit deeper and getting into some of the examples in the database, the dental clinic model, an example of that would be the Walker Methodist Dental Clinic, which provides oral health care to older adults in Minnesota. And they do this by either utilizing their on-site dental clinic, but also providing additional information related to oral health care for older adults, and also teaching geriatric oral health care by way of continuing education courses to dental professions. So that's what we would consider the on-site, the fixed clinic model, which is open in Minnesota 4 days a week and staffed by the University of Minnesota Dental School faculty and students. Second example I mentioned is the mobile portable model, and one example in the database is from the Senior Mobile Dental organization, which provides portable dental equipment to communities and facilities to supply oral health services for older adults. And the program is staffed by dentists, hygienists, and denture technicians to be able to really service the entire spectrum of oral health needs by way of mobile dental. The other example that I referenced is the eligibility and enrollment model. We find that in an organization in Massachusetts called the Elder Dental Program, and essentially they provide financially eligible individuals with a program manager to be able to find a dentist in their particular area. The virtual model, as I mentioned, teledentistry. An example of that is the virtual dental home provided by the University of Pacific. And essentially, dental hygienists and assistants gather diagnostic records and are able to provide oral health services to individuals in the community, again, using the telehealth system to form treatment plans. Event-based model that I alluded to earlier, such as Missions of Mercy, or this particular example, which is from the Area Agency on Aging of Western Michigan. And as I mentioned, these organizations they serve as the bedrock of the aging network across the older American spectrum. And this particular example from Western Michigan provides an annual event organized by this Area Agency on Aging that provides free dental cleanings, x-rays, screenings, and referrals to low-income older adults in the Grand Rapids, Michigan area. So whether it's this type of example or another large-scale event, such as Missions of Mercy, where they're able to provide services to hundreds of thousands of people on a one-day type of offering or a weekend, that would be considered an event-based model. Lastly, the outreach and education model example comes from the Alaska Dental Health Aid Therapist Education Program, and essentially provides dental providers an opportunity to live and work in Alaska, but also providing very essential information to dental therapists and those that serve older adults and people with disabilities. Mary mentioned the oral health guide, and on our website that I'll walk through momentarily, we include a tab of the entire guide, which essentially is a step-by-step program that will allow an organization to start or enhance an oral health program for older adults. It begins with being able to conduct a needs assessment, starting from the very beginning and understanding the community that you're serving and making sure that the program that you're building, either from the ground up or enhancing, is truly meeting the needs of your community. Then it transitions to developing a vision, mission, and goals, all the way down to how to finance the program, including examples of funding that other organizations similar to your makeup potentially have financed their particular program. Lastly, it concludes with sustainability. It's one thing to be able to get the initial money to be able to offer an oral health program in a community, but how is that sustained? So there are examples of being able to sustain and build a program that has longevity in a community. So with that being said, I'll go ahead and transition to the website. Give me just a moment while I bring up the website and get the technology all squared away. And on your screen, you should see in front of you the home page for the Oral Health website. And that website is oralhealth.acl.gov. And I'd like you to walk along with me, if you don't mind, as we toggle through the various aspects of the website. And we'll focus on just a few. As I mentioned, this website includes a searchable database of programs. You'll see here on the home page, we give a basic overview. But we also want to point out very clearly right up front that this website is not necessarily meant for a caregiver or an individual to be able to provide, to be able to find services for the one that they're providing care for or their self. It's a means of an organization to be able to find a program to be able to replicate or start from scratch. But we do direct people to a website that would assist in finding individual care for themselves or one that they're serving as a caregiver for. And that is the Tooth Wisdom website operated by Oral Health America. So if you'll transition to me to the Find a Program tab, and that is what we consider to be the database. And since a number of you are from the Texas area, we'll go ahead and start off with a search for Texas. But as I mentioned in some of the slides, there are a number of criteria that you could use. As mentioned in my bio, I come from the transportation world and being able to provide technical assistance to transportation providers and communities. And if transportation was a focus of the type of the program that you're looking for, and you wanted to see what services are provided in addition to the basic oral health needs, you'll be able to find that by clicking on the Transportation Services tab, in addition to any others. So you can get really specific in your search, but for the sake of the call today, I'll just type in Texas on the search bar and hit submit. And what this does is it brings up all of the programs in our database that are in the state of Texas. And as you can see here, as I mentioned earlier, the star indicates programs that are considered featured programs and provide a little bit more of a robust program profile. So we'll pull up the San Antonio Christian Dental Clinic, which is a featured program, and we'll click on that, and it will populate the program profile for that particular program. It'll give you a little bit of background here in the profile, program history, the program impact, the website to be able to get more information on it, but also the boxes that it checked as it relates to the particular criteria. So this is, again, what we call the program profile. It's what populates when you search for a particular program and click on that particular program. And again, the featured programs populate a robust profile, but the programs that are not considered featured also have a program overview and a link to the website. So you are able to get more information on that particular program, as well as the criteria that this program falls into. So going back to the Find a Program page, again, you're able to search by a particular criteria, as well as the various aspects within that program if you're looking to search the database. The other major component that both Mary and I spoke to earlier is the Oral Health Guide. On the website, if you click on the tab indicated Oral Health Guide, you're able to walk through the step-by-step guide and document that I mentioned. You're most importantly able to download the entire document by way of PDF if you'd like, but if you're looking to hone in on a very specific aspect of a program that you're starting or enhancing, you can drill right into that one there, such as designing the program. And you'll be able to walk through the various aspects that we have in the Oral Health Guide in designing the program here on the website. So again, if you're looking to focus on a specific aspect, you're able to do that right here on the website, or download the entire document. That's the Oral Health Guide, and again, it allows you to be able to walk through step by step on how to start or enhance an oral health program for older adults in a community. The last aspect of the website that I wanted to identify for you all is the Submit a Program page. We knew that as part of the environmental scan, we wouldn't be able to get a full understanding of all of the programs that serve older adults and people with disabilities, but we did want to provide an opportunity for those that we may have missed to be included in the database also. So there is an opportunity for an organization to submit a program and do that right here on the website, and as part of that, the program features, similar to those that populated on the program profile, we'd like to know what aspects of the program that particular organization features. So when someone is submitting a program, they'll check all of the boxes that are applicable to their particular program. These will be evaluated using the same criteria that we use to evaluate those other 200 or so programs included in the database. So while we knew we wouldn't be able to cover the entire spectrum of programs in our environmental scan, we did want to provide an opportunity for an organization to submit a program here on our website. So I think we have time, about maybe 15 minutes or so, for questions. I think Mary has been monitoring any questions that you all have submitted through the chat pod. I encourage you to continue to do that as we address some of those questions in the chat pod. And as we're answering questions, please walk through the website and identify yourselves with or familiarize yourselves with the website and the various aspects thereof, and we'll answer as many questions as we can within the allotted time. Mary, did you get any questions in the chat box?
Fontaine, we don't have any questions right now. As they come in, I'm going to take advantage of this time to just say that yesterday I presented on the same program at the National Association of States United for Aging and Disabilities, and I want to put in a plug for them. They are doing a new initiative in oral health in America, and they've just come out with a wonderful infographic on experiences of older adults and persons with disabilities on oral health. And I just want to share with this group, as we're talking about the importance of oral health in older adults, a number of the statistics that they bring up in terms of the cognitive, physical, and behavioral limitations that make it difficult for people with cognitive and different physical disabilities to brush and floss their teeth, and certainly individuals with dementia may forget to even do that. And when we were talking, they were citing, you know, the extraordinary issues of oral health is related to aging in terms of people with multiple chronic conditions, the medications that they take that actually cause different oral health conditions. And one woman brought up that they're seeing a lot of aspirational pneumonia in their community, and it's not just the older adults, it's younger adults who with very, very poor oral health are aspirating the bacteria, it turns into pneumonia, and some of them have died. They were also talking about the issue of mental health and asking if there are materials for care, addressing oral health and providing oral health care for individuals with different mental conditions that may not understand the care that's being offered to them. So I think they obviously are very committed to the topic of oral health in older adults, but citing some of the unique and really urgent issues that are driving this interest, particularly for the oral health and older adult population as opposed to children. So I have nothing else to offer on that right now. We have no questions through the chat at this point. Happy to answer any questions that anybody might have, but I'm going to turn this back over to David.
Okay, there is one question, and we may not be able to get to it. It's from Nancy Blinn, and she's trying to type it into the chat box.
Okay.
If anybody else has any questions, you should open up your chat box, and you should type in the question and make sure that it's visible to all or the entire audience. And if we're running into some technical difficulties and we need to address the question offline, as we mentioned earlier, this webinar will be recorded and we can connect you via email to the presenters if you have a question and we're unable to get to it today. Okay. So if there are no additional questions, I want to thank both Mary and Fontaine for being with us today and remind everyone here that this presentation has been recorded. It will be archived on the ROHDEO website. If you want notification of when this will be available, please go to the website www.rohdeo, and you will be able to enroll in our listserv, where you will be updated when this webinar is available. You'll also find information on how to register your program on this website, submit your program data, and you'll also find the presenter's contact information if you have follow-up questions. So once again, thank you so much, Mary and Fontaine. We appreciate you being with us today. And with that, we'll go ahead and conclude the webinar.
Thank you.